Hi everyone, we're out here in Houston today. We have Julia who is getting her abdomen done, a little bit of her back done, and then is getting fat transferred to her butt. So she's already had her abdomen done and her back done, so that we've already contained the fat, but now we're gonna bring that fat into her butt. So one cheek is done while the other one is not, so you guys can see a little bit of the comparison. And then we can ask Julia how she's doing. So let's go on in. Hi everyone.
Hi Ethan.
How are we?
Good. Awesome.
Julia, how are you?
I'm good.
How's everything going? How's your procedure feeling so far?
Good, easy. They've been great.
Oh, that's amazing. So I talked a little bit about what you're doing, but why don't you explain it to us? What did you want to get done today?
So I wanted to get my stomach area, my back, and I'm getting also a BBL.
A BBL. Okay, so you're a pretty healthy person.
Yeah.
So let's talk a little bit about that. Why did you want to get this stuff done?
Well, I work out all the time, and I had like some stubborn areas in my stomach and my back, and like I could not get rid of them. And no matter how much I dieted and like worked out, I would like lose it in areas I didn't want to lose it.
Sure.
And it was just kind of, areas that I didn't like, and I wanted to get rid of.
Amazing. That's awesome. So while looking at this procedure, there's a lot going on and everything, but how does it feel when we're finally taking that fat out? How does it feel?
It feels really good.
Yeah.
And they keep saying like, "Oh, you look so snatched," and that's so good. So I'm really excited to see it. It's been really easy, a great process. They've been amazing.
Yay! Well, yes, you do at the beginning here, you do really see a result, and then obviously as we recover and the swelling and everything from the numbing liquid goes down, then you can definitely start seeing even better results. But I'm glad you're seeing results already on the table.
Yeah.
So we're actually already at the fat transfer part. But overall with this procedure, as far as the fat removal and a little bit of the fat transfer now that you've experienced, how does it feel?
It feels really good. I was nervous that I was going to be like painful or something like that, but it has not been at all. It's
amazing.
Been really easy. The laughing gas has been really great. And, yeah.
Yes. I'm sure that helps. Yeah. Well, I'm glad that you're feeling good, and I'm glad, as you guys heard, she is awake. She is feeling good. There's not too much. She's not having too much pain. I think the only pain that we kind of like talk about in this procedure is a little bit of pressure, right at the beginning from numbing.
Pain.
Yeah, it's just like you feel a little pressure, but nothing too hard or anything like that. And I think it's uncomfortable at that point, but that's about it.
Yeah.
But then, I mean, after you get numbed, you feel...
No, you feel great.
Feel great. The tool, what is it? Is it kind of just feel like what does it kind of like feel like to you?
It feels like a vibrating, like massage.
Yeah, just like a little massage. Yay, we love a little massage. Massage where we're taking the fun out, or we're taking out all the bad stuff and having more fun. So
yes, exactly.
I'm glad. Well, how much fat have we already gotten out? Doc, how are we doing?
I put a little bit in. We got about 1 liter off.
1 liter out of there?
Which is a lot for her.
Yes.
Fit and thin.
I mean, look at her snatched little waist here.
Yeah, that's what we're really, truly AirSculpt. We sculpted that out. So.
Amazing.
And now we're just going to try to get a little bit more projection.
Yeah, so explain a little bit of the fat transfer. So what did we do already?
I just added a little bit on this side, trying to get a little bit more projection. And then also get a little bit of this nice kind of heart-shaped sweep here. And
Perfect.
She had a little bit of a hip dip. We corrected some of that by taking the hip down with the AirSculpt, and then with the PowerBBL, we'll just put a little bit of fat in there.
Okay, yeah, I see that a little bit.
Yeah.
So we're just kind of almost just making her butt a little more full, is basically a real more rounded out.
We're lucky she started out with a great base, so we're just kind of, enhancing that.
Yeah, for sure.
A little bit more shape, correct the hip dip, and then add some projection.
Amazing. Well, awesome. Julia, so as far as the procedure and everything, we like to keep it fun in here. So what music were you listening to?
Yes, we did like Kanye.
Kanye.
So we had Kanye. Yeah, we got to pick the music, and it's been really good.
Yay, I'm so glad. So you don't live here in Houston, do you? You guys travel down and everything?
Yeah, we traveled here, and for the whole process, it's easy. It's been, great.
Yay, I'm so glad. How's your experience with leading up to this procedure been so far?
Amazing. Everyone is super great with communication, checking in, making sure I knew exactly what I needed, when time to come, and just been super friendly.
Well, that's amazing. I hope that your experience is the same experience for everyone, and I'm glad that you're having a good time already.
Yes.
So, with a little bit of the procedure, so for those who just started or just joined us, she got her abdomen done, which is her stomach region, a little bit of her side and waist, and then a little bit of her back done. And now what we are doing is we're transferring that fat to the butt. Julia's already a pretty healthy person. She works out. She already is a very fit person, but she has some areas that she wants to address. And here at Elite, we like to give you guys a little bit of confidence. That's all we're selling here, is we want to give you confidence. No matter what your results you are trying to achieve, it's all about making sure that you're happy with it. So far, if Julia's happy, we're happy. Okay, amazing. So Doc, let's talk a little bit about AirSculpt and what that is. So why do you like doing AirSculpt?
It's just great, and as you can see from what we showed with the waistline, it's
Yeah.
just getting every little bit of fat out. It's so efficient at removing fat, and just really, we truly are. It's a sculpting tool. You can see just the shape here, how it's just the contours and the sweep and the snatched out waist. So it really is a very unique tool for body contouring.
Amazing.
And then with that, it was so efficient. With someone small like her to get enough fat to do the power.
Well, yeah, for you, 1 liter of fat,
Yeah.
that's a lot.
That's just speaks to the efficiency of the AirSculpt.
Amazing.
And that just allows us to do a better job with the PowerBBL.
For sure.
Yeah.
What, so with recovery of a procedure like this, what does that usually look like?
Well, we don't want to put any pressure on the fat for about 3 weeks. So we want her up moving around, light activity, especially the first couple weeks.
Sure.
And then after about 3 weeks, you can start doing a little bit more. I usually have them not put a lot of directed pressure on between
For sure.
about 3 and 6 weeks.
No sitting on the butt.
Yeah.
I know, that's the hardest part.
And so we just really want to give the fat every opportunity to take in there and maximize how much of the graft actually is there, and that's going to give us the best outcome with the PowerBBL.
For sure. What is the likely, or what's the percentage that usually most fat survives from stuff like this?
Yeah, usually it's quoted around 40%, but I've really been surprised. A lot of the patients I've seen back, it seems like it's maybe only 20% loss.
Okay, great.
So,
that's not bad at all.
No, but it's gonna vary from individual to individual. But I think we really get good grafts with the AirSculpt, and so better grafts, better outcome.
Sure, absolutely. So with fat transfers, we don't only do the butt, right? So what are some other areas we do?
Some patients have nice fullness in the buttocks area, but they have a little bit of a dip there, so that's called a hip dip. She
Hip
had
dip?
a little bit. I usually correct
Yeah.
those if they're there.
Here
when
I can
do
show a little bit again.
when I do a PowerBBL. So we corrected that area there, and then obviously the PowerBBL, and then the upper cup, where we're trying to add a little bit of volume, especially projection, upper pole fullness on the breast.
Upper cup is the breast area.
Yeah.
Got it. Amazing. So let's see here. What other questions can I ask you while we have you here? How soon can so after the procedure, they have to wear a garment, right? Like a compression garment. So how does that usually work, and how long do you usually have to wear those?
In general, most people wear the minimum of 2 weeks, but I
2
tell
weeks.
patients if you're still experiencing swelling, you may wear it during the day for another 2 to 4 weeks.
Sure.
It's a tool, use it if it's helping you. We also incorporate some recovery foam in there as well to add some more directed compression.
That's good.
I feel like if we get the swelling out of the tissue, even in skin that's a little bit more compromised with stretch marks, more laxity, I think if we get the swelling out of that tissue early, it has a better chance of retracting.
Sure.
And you get a better result.
So 2 weeks, and if they choose to do more, they more than welcome to.
Yeah,
And then-
I feel like if they still have swelling there and it's helping them,
Yeah.
minimum wear it during the day when you're most active.
Wear it at
not
night
sleep
when you go to bed or something
and
like
then
that.
you just trial without it and see if you swell anymore with or without the garment. If you're still getting swelling, continue to wear it. So I have some patients that have really attenuated, compromised skin, and I've had them wear it. They've worn it for a couple months, and it's really made a difference too.
Awesome.
So, yeah.
What? I had a question. Oh, for someone like Julia here, who is active, when can someone start working out again?
If she had just the AirSculpt, I would tell her at 2 weeks. She
2
could
weeks.
Go back and just ease back into a routine.
Sure.
Some people are doing really intense stuff, and I don't want them to jump right back into it. With the fat grafting, I usually have them wait about 3 weeks, and then again ease back into it, but don't put direct pressure for about 3
Right.
to 6 weeks on the areas that have been grafted.
So when you get fat transfer, it's a little different. You get you have a little more recovery time, so you got to be really careful because you don't want to lose fat. But if you were just removing the fat, we usually go around 2 weeks, so that's good.
Yeah.
Good to know.
I encourage her, even for her, even have the grafting, to go out and start walking. You know, I always say if you have a dog, take your dog out for a walk, but
For sure.
nothing strenuous.
Yeah, like
Just for circulation.
just like something that kind of helps with any sort of recovery, right? It's always good to get a good walk out anyways. All right, guys. Well, thank you for letting us check out this procedure. Julia, thank you so much for talking to us. Nurses, thank you as well. And doctor, thank you so much for talking to us as well. And
Thank you.
we'll let you guys enjoy your procedure and get back to your Kanye and hanging out. And we'll let you guys go. So thank you so much.
Bye-bye.
Bye-bye.